Another study that we actually will present here at ESC is actually a study that looked into adherence, and obviously adherence is a very hot topic these days, and what we show here is that a very simple application, a mobile app application on your mobile telephone could actually substantially enhance the adherence of patients who actually had experienced an acute coronary syndrome. It looks also into quality of life questions and appreciation of the patients who actually use the application. What it showed first of all that there is a trend of better adherence for the patients that actually were provided the application. But in addition to that, and I think is also very important, is that it has a higher satisfaction of patients comparing, for instance, to electronic diaries. It's SMS messages that are directed towards the patient in order to remind them about taking the drug and giving them hints of how they change their lives, how to initiate lifestyle therapy, etc. In addition to that, what you also see that with regards to communication is that physicians usually provide their patients with a certain routine. Mm-hmm. The best thing to do is like either you take it in the morning or you take it in the evening. Mm-hmm. And all this app does is remind you of when you need to use it and provide you with little reminders of when you should use it and provide this type of support. So I think it's an intriguing aspect for the armamentarium of treating physicians to support adherence and motivate patients to continue using drugs and initiate lifestyle changes, which are as important for these patients. It falls with this type of therapy, particularly for Brilinta, because with Brilinta it's a reversible agent. So you need to have a continuous exposure over time to have the maximum effect. So if you drop adherence for a significant point in time, you lose your ability to reduce and inhibit platelets very differently compared to some of the other oral antiplatelet drugs. So it's for Brilinta it's of critical importance. I don't know whether pharmaceuticals in general, but for us, within AstraZeneca, we put a lot of emphasis with regards to adherence because it really provides support for patients that are in need of continuous therapy given their underlying risk for future cardiovascular events.